I'm Michel Nishan, and I'm with Wholesome Wave. And we are a 501c nonprofit that basically develops programs and then partners through other nonprofits to really try to create opportunities where access and affordability really intersect in the same community. We do this not only to benefit folks in underserved communities who don't have affordable access to healthier foods, but also prove that there is demand in these communities for healthier food choices, and that where there is demand, there's potentially viable food commerce. We founded in 2007, but had been working since 2002 around some premises. My co-founder, Gus Schumacher, a former two-term Undersecretary of Agriculture in the Clinton administration, created the WIC Farmers Market and Senior Farmers Market Nutrition Program, believed that one of the best things that we could do to restore viable regional agriculture was linking underserved communities with farmers, and that in doing so there were enough federal resources there to support the notion that we could repurpose the way that federal food dollars were spent. Back in 2006, Gus got together with a gentleman named John Hyde at the Crossroads Farmers Market and developed a design of a program that was funded by the Kellogg Foundation that was the first ever incentive program. We were so excited about the program, we decided that that would be the founding premise of Wholesome Wave, and that one of the first programs that we would work on would be an incentive program. And I can't tell you how many people in the nonprofit world and in the funders world told us that we were crazy, that it wasn't going to work, that there wasn't going to be demand in these communities, that the educational barriers and outreach that we were going to face, because in these communities people didn't know what to do with fresh food. We were encouraged by many not to found our organization on that. We started in 3 states and 8 markets in 2007, and in 2010 we were in 120 farmers markets that finished our study, 175 markets in 20 states. And what we found, that I can't share you the bars and the graphs, but I'll tell you some of the data. We just finished cleaning our data this summer, and here are the outcomes. There is demand in these communities. When we went to farmers markets that were accepting EBT in the states, and this is urban and rural communities, we found that there was a minimum increase of a 200% redemption rate in SNAP redemption, and a maximum of 2,500% redemption rate increase, with a median of about 350% increase in these communities when the incentives were introduced. We interviewed over 2,000 SNAP recipients and WIC recipients, 550 of which filled out every question, so that's what we did our database on. And we asked 12 questions as what were the most important reasons why folks were coming to the market, federal benefit recipients. The number one reasons we always expected would be that the market accepted federal food nutrition assistance, and that those benefits were doubled, so the affordability that they cause. The number one reason why SNAP and WIC recipients came to the markets in level of importance was quality of produce. The number 2 reason was that the market accepted federal food assistance benefits. The number 3 reason, which was a question that we were forced to add by the farmers in our learning community because we had not previously asked it, and we were afraid to ask it because we thought it would be last. The number 3 reason that people felt it was important to go to the farmers market was to support local farmers and businesses. The number 4 reason, taking part in the community. The number 5 reason, selection of produce. The number 6 reason, the price of the produce with the incentives. What we found is when the incentives went away in the markets, that the redemption rates remained high. The average dip in redemption rates in markets that ran out of incentives was only 15%. So in a market that experienced a 1,000% increase in incentives, and this speaks to Michael's data that he shared from the WIC study, there now are 2 studies that show this to be absolutely true. If you increase your redemption rates 1,000% of SNAP or WIC at a market as a result of the incentives, when the incentives went away, you still had over 900% increase in sustained redemption rate increase. In Waverly and Baltimore, we ran out of incentives in 5 weeks because of the rush on the market, and the SNAP redemption rates skyrocketed long after the incentives went away. So I think we proved that incentives and food incentives, healthy food incentives in communities actually are a very good investment of philanthropic dollars. What it meant for our farmers, 1,700 farmers participated in our survey. 15% of those farmers added acreage or increased their plantings to reflect the ethnic preference of this new market that they were exposed to. 12% of these farmers extended their seasons. 8% of them built hoop houses, and here's something that's very, very interesting. Someone would say, why would you need to add hoop houses? Because you've added SNAP access and incentives to farmers markets. Most of us in this room stop going to farmers markets when it gets cold and rainy and snowy. Somebody where the farmers market is the only affordable access that they have to locally grown fruits and vegetables, healthier food for their family, they go if there's a foot of snow on the ground. They go. Over 30 of our markets extended their market season an additional 6 weeks to deal with that demand. So that's remarkable stuff. What does that mean? There's food commerce. Incentives are a great tool to prime the pump, but there's food commerce in these communities. And that's without sophisticated outreach. That's without tremendous amount of marketing dollars. In Michigan, where Orrin Hesterman is working with Fair Food Network, where they invested heavily in communications outreach, they've done over $1 million now in Michigan this year so far in SNAP redemption. That's remarkable stuff. So what does that mean for communities? First of all, incentive programs are a great place to invest if you're a philanthropic organization. They immediately cause people to make a healthier food choice, immediately. And then those healthier food choices sustain as the market season goes along. They immediately benefit local food production and increase local food production and change the food that's being produced to be more culturally appropriate for the communities. What happens if we can multiply this in the many, many markets? What that means is when we look at new markets tax credits, when we look at treasury money, when we look at program-related investments, when we look at donor-advised funds, and we look at the many in farm credit and the many related grants that can come along with those funds, let's look at multiple models of food businesses to invest those financial instruments in. Let's look at the type of food businesses that can go anywhere from a green cart or a food cart to the size of value-added processing facility that can actually change school food for 6 school districts, a half a dozen hospitals, and a dozen colleges. I look at Mike's model, and it's funny, we're talking earlier, he's like, oh, it's not a big deal, we're like doing our small thing. $4 million is a small business. $1 million is a small business. When you look at what these guys are doing with food distribution, it's a remarkable opportunity. These guys are likely $250,000 to $500,000 in investment and a good business plan away from highly becoming a $3 or $4 million business, and Michael being able to do $10 to $15 million in distribution. And then the opportunity for them to partner with the grocery industry, because these types of opportunities of food distribution and value-added processing can actually change the stuff in the center aisle of a grocery store. Farm Credit has admitted this year that it would be an appropriate use of farm credit to finance the stake of urban farmers in a rural food business. Now, what kind of an opportunity is that? So when we look at incentive programs and we look at the space that they create, and most importantly, the way that I believe they've changed the face of federal food assistance benefit consumers, anybody living at, near, or below the poverty level. These are families who absolutely understand that they should be feeding their family better food. They know they can't afford to do it. When the opportunity comes for them to be able to afford to do it, they rush to it like you wouldn't believe. And when the affordability that's created by incentives goes away, they continue to shop at the place that they love the most. They value the relationships that they make in the community. They're comfortable dealing with that style of food access. The types of businesses, farmers markets are small businesses. So I think what we need to do is look at the multiple models of food business that are available in these communities that can be supported by the type of commerce that we've proved in our programming. What's really significant now, and I'd like to thank Kevin for mentioning the regulation change. We worked hard on that stuff. I know what he's talking about. It's the elimination of the demonstration exception pilot waivers, the elimination of the alternative currency waivers, and the loosening of the restriction around what it takes to get a SNAP number to accept SNAP at a farmer's market. All of those things were made possible because of those pioneer philanthropic investors that invested in these incentive programs, because it's the outcomes of that work that created those regulation changes. There are administrative rule changes that are being thought of right now that have nothing to do with the Farm Bill. We have a fruit and vegetable prescription program right now where we've raised enough private money to deploy through doctors and underserved community health clinics enough affordability for them to prescribe to an entire at-risk family enough fruits and vegetables to increase their consumption 1 to 2 servings per day per person for the entire market year. And because it's a prescription, they will be measured for health outcomes. And we are going to be sharing that information this spring. The opportunity for savings and reduction of healthcare costs, increased food commerce in these communities, and the way that these Treasury investment instruments can actually be used to provide real business opportunities and real jobs so that there is community ownership and equity in some of these food businesses, we can change the world through these types of programs. But it only works when we have the will and the courage of the philanthropic community. There are risks in some of these notions. When we look at food hub style businesses, value-added processing, mobile slaughter units have become the cause célèbre. Just like the infrastructure is missing for small and mid-scale animal producers to reach the market, the same thing's been disassembled in the value-added production world. There are lots of 600-acre mid-sized farmers that are in threat of going out of business that would love nothing more than to turn their 6.5 metric tons of waste into oven-roasted vegetable lasagna for grade schools. The opportunities are out there, the demand is there, and when access and affordability meet, education becomes a lot easier. It's one thing to teach somebody how to cook broccoli when they can't afford it, but when they can afford it, you get a whole different outcome. Anyway, I think there are great investments here, and I think the opportunity for partnerships across sector that this type of activity can create are exciting, they're real, they're palpable. Those of you that have been supporting this type of work, I thank you. Those of you who are considering supporting this type of work, get off the dime and do it. There's nothing more rewarding than seeing real palpable outcomes, and I thank you for your time.